During a supervisory visit to an immunization session, you observe a health worker scold a young mother for being late to bring her infant for vaccination. How do you think this mother feels about the interaction? If you do not address this situation by providing feedback and coaching, the health worker may not recognize the problem and the impact it can have on children's health. Many things may impact a caregiver's experience at an immunization session, such as wait times, the facilities, and the convenience of the time and location. Another important factor is how caregivers are treated by their service provider. This experience has a great impact on their decision to return in the future. Similarly, many things impact a health worker's ability to provide quality services, including adequate time, training, and their own experiences, perspectives, and biases. Managers can help ensure that health workers have the time and support needed to provide quality services. By coaching health workers to create a welcoming environment, you can improve the quality of service delivery and help increase vaccine uptake. In this video, we will review a few key strategies for coaching health workers to create a welcoming environment for all caregivers. But first, what is a welcoming environment, and what can health facility staff do to create one for caregivers seeking immunization services? A welcoming environment is respectful, responsive, and empathetic to the needs and experiences of everyone. This includes women, men, and youth, and those who may be stigmatized and marginalized. To create a welcoming environment, health workers may welcome parents and caregivers with warmth, empathize with caregivers by demonstrating that they understand their questions and how they feel, keep their messages simple, clear, and in local languages that will be easy for caregivers to understand, listen actively and show interest in the caregiver's questions and concerns, and set aside any personal biases and beliefs by treating everyone with respect. How do you know if health workers in your district need coaching to create a welcoming environment in their facilities? Start by observing health workers during an immunization session. You may also find it helpful to hold exit interviews with caregivers after they receive services, or conduct a survey of caregiver perceptions of the quality of care. Be sure to include both women and men in your interviews and surveys. Talk with people from a variety of cultural, socioeconomic, and religious backgrounds, as well as people of different marital statuses and ages. After gathering information, offer constructive feedback to the health worker based on what you observed and learned. Begin with positive feedback so the health worker will feel valued and be open to corrective feedback. Then identify the specific behavior you observed and its impact. For example, to the health worker you observed scolding a young mother who was behind schedule for her child's vaccinations, you might say, "You have taken care to inform the caregiver about adverse events following vaccination. You have not addressed her with warmth and understanding." Once you identify the behavior, emphasize its impact. Why do the health worker's actions matter? You could explain that when caregivers do not feel well treated during a visit, they are less likely to bring their children back for vaccination, resulting in missed opportunities for vaccination. It is also important to ask questions to understand the reason for the behavior. Is it a lack of skills? Or are there challenges that prevent the health worker from doing something correctly? Other changes, in addition to coaching, may be needed to support health workers to create a welcoming environment. You may also ask the health worker reflective questions to help them understand how caregivers experience immunization services offered by the facility. For example, you could ask, When you think about a caregiver's experience at an immunization session, what might be the most difficult part? Or, given the challenges a caregiver might experience, what might motivate them to bring their child to complete the immunization schedule on time? The more that health workers understand the experiences of caregivers, the better they can empathize with them and respond to their needs with care. Reflecting on caregivers' experiences will also help you and the health worker to identify solutions to problems together. It may also be helpful to demonstrate the skill for the health worker. For example, you could model the behavior yourself, greeting caregivers warmly, actively listening to their questions and concerns, and showing empathy and understanding. Then, provide opportunities for the health worker to practice their skills. Role-playing could help a health worker practice their skills in a safe environment. For example, you could act out a scenario that the health worker may encounter. A mother arrives late to the health facility with a newborn and small child after a long journey. She has come for vaccination but has forgotten the immunization card. Ask the health worker, how would you interact with a caregiver in this situation? By using simple and genuine ways of demonstrating care and respect for caregivers, health facility staff can increase the uptake of immunization. And by coaching health workers, you can help support them in this effort. You should now know a few key strategies for coaching health workers to create a welcoming environment for all caregivers.